So good afternoon, everyone, and welcome to Member Cafe. Just going to wait just a few minutes before we get started while our attendees start logging in. So just a minute or two to get everyone in before we go. All right, so good afternoon. My name is Ann Gluff, and I am part of the member engagement team here at Partners. So glad to see you here today for our December Member Cafe. So joining me today from our member engagement team is Stacy Lawrence. She is going to be putting some information to the chat for you, so it's super easy for you to copy and paste. We also have Allison Crotty, our Senior Director over Member Services. Cindy Trobaugh, Member Engagement Manager. She's going to be moderating our questions for us today. Rachel Jerzak is joining us as a guest speaker. She is our Director of Intellectual and Developmental Disabilities Care Management. And in the background, we have the wonderful Terry Christie, and she is going to make sure that our Zoom runs nice and smooth today. So I'm going to share a few housekeeping items with you while Terry brings up our slide deck for us. So one thing I wanted to tell you today is that we are offering this session in closed caption. So there will be some titles for you. And if you don't need those, you can simply click on show captions and turn those off if you don't need them today. And then we are, as we go through our session today, I know a lot of times we have, lost my train of thought. A lot of times when you're listening to information, you think of questions as we're going along. We are going to stop at a certain point for questions. So I want to encourage you, if you have questions as we move forward, to enter those into the Q&A feature. You can see that at the bottom of your screen. It's got two bubbles above the letters Q&A, and that's going to enable you to type your question in. You want to make sure that you don't share any personal information in that question area. If there are things you want to talk about your specific family member or someone that you're helping, if you just reach out to us, we're going to share some contact information for a one-on-one appointment with us, or we can call you, however we want to work that out so that we can get your questions answered. So we are recording this session. And after the session is over, we're going to send you all a follow-up email. And in that follow-up email, you're going to get a copy of the slides. And also you'll get a copy of two different flyers, I think, for this session. So just great reference information for you to look at after the session. And also during our Q&A, if you prefer to talk and share your question out loud, you can simply raise your hand and Terry can unmute you so that you can share your question with everybody. All right, so I think we covered everything there in the housekeeping. So let's go ahead and get started with our session today. So before I talk about partners, I want to just share that our main topics today are Medicaid expansion. We're going to share information about that with you first. And then Rachel, our Director of IDD Care Management, is going to talk about a little bit about tailored care management and the recent updates to the innovations waiver. So Partners Health Management. So for those of you who are not familiar with Partners, we're an insurance company. So we are contracted by the state to manage Medicaid and state funds. And the population that we focus on are those individuals who need help in the area of mental health, substance use disorder, intellectual and developmental disabilities, traumatic brain injury. So all of those areas, we have a network of providers who are experts and specialize in those areas. So when you're working with partners and the providers in our network, you won't actually see partners for that treatment. You will be connected to one of our providers who, again, it has that area of expertise in all of those areas that I mentioned. So right now, again, we're contracted by the state of North Carolina with Medicaid, and we're currently managing North Carolina Medicaid Direct for behavioral health. And so when you think of the words behavioral health, think of mental health conditions, social and emotional disorders, substance use disorder, that all is encompassed in behavioral health. And then also we support individuals with intellectual and developmental disabilities and traumatic brain injury. So along with Medicaid Direct, we are also managing the 1915I state amendment, and I should be able to share some more information about that. You're probably familiar. Also want to let you know that we have a 24-hour a day, 7 days a week crisis call center for behavioral health concerns or for mobile crisis. We're going to share that number with you later on in the session. And in 2024, the tailored plan for North Carolina Medicaid is anticipated to start in the first half of 2024. We're thinking around July 1 is what the focus is. And so we'll be managing that plan at that time as well. But overall, our goal is always to improve lives and strengthen our communities. So on our next slide, what you'll see here is a timeline. So I mentioned Medicaid expansion. We're going to talk about that today. That launched on December 1st. So we're already here. Today's December the 12th. And then in 2024, February 1, there is some county realignment, and Davidson County is going to join us here at Partners Health Management. Also on February 1, another program is going to launch. The name of that program is Healthy Opportunities. It's a pilot program, and I'm going to tell you a little bit more about that during our session today. And right now, as the pilot, it covers Rutherford and Burke County in our area. On March 1st, 2024, the Innovations Technical Amendment will go live, which is what Rachel is going to share a little bit about with you today. And again, as I mentioned, the tailored plan will launch in 2024 prior to July or by July 1st. So next, we are going to move into Medicaid expansion. I'm sure many of you have heard about Medicaid expansion, and you know that our Governor Roy Cooper, signed a bill back in March that expands Medicaid. And so what that means is more people in North Carolina have the opportunity to be covered by Medicaid. Over 600,000 North Carolina residents who have not previously been able to access Medicaid will now be able to do so. So this truly is a historic moment for North Carolina and the health and well-being of all of the individuals who live in North Carolina. So what does that mean? So starting December 1, more North Carolinians are eligible to receive Medicaid, and Medicaid will now cover people ages 19 to 64 years of age with higher incomes than previous. It means that you may be able to get Medicaid even if you didn't previously qualify for it. And so what does Medicaid do for you? It pays for doctor's visits, yearly checkups, it pays for emergency care, mental health care, and more at little or no cost to you. Now let's talk a little bit about eligibility. With the expansion of Medicaid, that's what's changed, is the eligibility of the income levels have gone up. So adults ages 19 through 64 who have incomes up to 138% of the federal poverty level. And I'm going to show you a slide in just a moment that gives you a little bit more detail behind that. So what it means is parents with low incomes, about 34,000 for a family of three, may be eligible for Medicaid. Some immigrants, some veterans and their families, and then children who previously aged out of Medicaid, and women who are pregnant. So here's that slide I mentioned. It shows a little bit clearer what that means, that 138% of poverty level. So let's take a look at the left side of the screen. And there you see a table. It says size of the household and then the annual income. So you can see it starts there as a single adult with an income of $20,120 or less may be eligible for Medicaid. And then it moves up from there. Family of two goes up to 27,214. A family of three, 34,307. And it keeps moving up. Family of four, family of five, family of six, all the way up to $55,586 or less. And remember, you don't need to remember all these numbers because we're going to share this slide deck with you along with another flyer that's going to have that information with you. But just wanted to share it with you. So then if you look on the right side of the screen, it shows children and with children, with one child, it's up to $30,800. Two children, $41,600, and three children, $52,500. And then pregnant women at 196% of federal poverty level. And again, you see the numbers listed there. And the next one down is older adults over 65, people with blindness, people with disabilities. And here asset limits also apply. And you can see there's some different numbers there. For one person, it's 14,600. For two, 19,700. All right, so this slide is going to focus more on eligibility. There's a lot of information on this slide, and this is about immigrant eligibility. We often get questions about this topic. I'm not going to go over every detail on this page, but what I want to share with you is for an immigrant eligibility, the person must be living in North Carolina, and they must be a non-citizen with qualified immigration status. And what you see down below there is all of the more detailed information about qualified immigration status, such as the need for a green card. And it goes through different scenarios. I will tell you that most people must wait 5 years, meaning they must be living in North Carolina for 5 years before they can receive Medicaid. This information, again, is going to go out with the email that goes out following this session. So I'll let you all read that information when you get it. All right, so let's talk a little bit about the services that are included in expansion. So Medicaid expansion, when you're eligible for Medicaid expansion, you're eligible for full Medicaid. And what that includes is inpatient and outpatient hospital services, vision and hearing, going to the eye doctor or an ear specialist, prescription drugs, going to the pharmacy and getting those medications that are prescribed to you by your doctor. Behavioral health. I mentioned those words before. So when you think of behavioral health, you want to think about mental health, outpatient therapy, different types of treatment and services available to those with mental health conditions, severe emotional disorders, substance use disorder, etc. The next one is preventive and wellness services. So what does that mean, preventive and wellness? So preventive and wellness is when you go to that primary care doctor that you choose and you go for your annual physical to make sure that you're healthy and you're eating well, getting the right things that you need, and maybe identifying something that you didn't know needed to be addressed. And you're going to learn more about wellness and nutrition and exercise, all of those things that keep you healthy. Full Medicaid also covers Medicaid-related devices and other therapies. One example of a device might be a CPAP machine for someone who has obstructive sleep apnea. It also covers maternity and postpartum care. So that means women who are pregnant, and then postpartum is after the baby comes and the care that mom and baby need after that. And then last on the list there is the dentist, going to the dentist for dental and oral health services. Oral health services, that just means good health in your mouth. All parts of the body need good health, and the mouth is included in that. So good oral health and dental. If you want to learn more about Medicaid, what full Medicaid covers, there's a link on the screen there, Medicaid, ncdhhs.gov/beneficiaries. And I know Stacy is popping these links into the chat for you so that you can grab those quickly and copy and paste them. All right, costs for Medicaid. There's no monthly premium for Medicaid. You don't have to pay any monthly premium. And Medicaid covers, all of those things that I was just talking about, most healthcare services. The highest copay for Medicaid is $4, and that is only for some services. And next, we're going to move into talking about the information that you need to apply. So some of the things that you'll be asked about for applying. So one thing I want to share with you about applying for Medicaid is Partners does not take Medicaid applications. So applying for Medicaid, that happens through your local Department of Social Services. So every county has one. It'll be located somewhere in your county. For example, here in Cabarrus, where I live, the Department of Social Services is located in Concord. So some of the information they're going to ask you for are things like your full legal name, your date of birth, social security number, or immigration status, proof that you're a North Carolina resident. And then they're going to ask you for income information. And that income information, you can prove that with pay stubs from your current paycheck, W-2 form, that's something that's connected to your tax returns, or tax returns or business records if you happen to be self-employed. Another link there right at the bottom of your screen about applying for Medicaid. And so you can go there if you want to learn more information about applying for Medicaid. So this grid shows you a little bit more about the Medicaid application process. Again, happens at your local Department of Social Services. And they're going to ask you for a lot of information. So one thing they'll ask is for you to prove that you are a resident of North Carolina. And that could be with a photo ID, like your driver's license, that has your North Carolina address listed. It could be your electric bill or your water bill, or possibly your lease from a home or apartment that you rent, or it could be your mortgage agreement if you own your own home and you're paying a mortgage. Could be possibly a vehicle registration. Again, it shows your name and it shows your current address in the state of North Carolina. And then they're also going to ask you for documentation of employment, which we just talked about on the previous slide. We talked about income on that previous slide. So with the documentation of employment, you may have something from your employer. If you don't, you're going to check a different box on your application. They're looking for your date of birth, again, with that photo ID or possibly your birth certificate, your social security number, which would be your social security card or another document that shows both your name and your social security number. Could be your military ID card. Citizenship proof is covered by a birth certificate or a passport. And then last at the bottom is immigration status. And that would be your visa or your immigration card. All right, now let's talk a little bit about family planning Medicaid. This is a level of Medicaid that you may have had previously, and it has limited benefits. It's not full Medicaid. So if you had family planning Medicaid prior to December 1, you should have automatically received full Medicaid benefits if you meet those new eligibility rules. And if that is the case, if you met those new eligibility rules, you should have or will be receiving a letter from your local Department of Social Services so that you'll know, you'll start getting full Medicaid coverage. And you're going to be assigned a health plan. If you want to change it, you will have 90 days to pick a new one. So it could be that you're part of Medicaid Direct, or it could be that you're choosing one of the 5 standard plans, which are WellCare, United Healthcare, Healthy Blue, Carolina Complete Health, or AmeriHealth Caritas. So the standard plan covers the majority of people with Medicaid. Some individuals will be covered by Medicaid Direct. So no matter your health plan, you will, if you haven't already, receive a new packet from your health plan. It's going to have your new Medicaid ID card, and your ID card will have the name of your primary care doctor. And that's that doctor I mentioned just previously when I was talking about going in for your physical exam, or going in when you're sick or when you're hurt. So that primary care doctor may be someone that you chose, or it could be someone that was assigned to you. And you can change that doctor that was assigned to you by contacting your health plan. So you're going to look on your Medicaid card, and your health plan is going to be indicated on there, whether it be Partners Health Management for Medicaid Direct, or it could be United Healthcare or Healthy Blue. All 5 of those agencies are companies that I named. One thing I want you to keep in mind with Medicaid expansion is if you had health coverage through healthcare.gov, the Affordable Care Act, sometimes called Obamacare, what I want to tell you and recommend is don't cancel your plan until you receive information from your new health plan to make sure Medicaid is in place. Once Medicaid is in place, you shouldn't have to keep that other plan, but you want to make sure you have that until it's in place. Then we're going to move forward and talk about how to actually apply for Medicaid. So again, I want to share with you that Partners does not take Medicaid applications. You're going to go through your local Department of Social Services, but there's a couple different ways you can do that, actually 4 different ways. One is if you're a computer person, you can go online and you can go to what's called ePass, epass.nc.gov. This is where you can fill out all the information online. The other option you have is a paper application. If you prefer to do that, you can get that paper application 2 different ways. One, you can go to the website on the screen here, ncgov.servicesnowservices.com, and you can download a paper application. Fill that out. It's going to give you instructions to either mail it in, or you can actually walk it in to your Department of Social Services. Or if you prefer, you can just go straight to your Department of Social Services and talk to them when you get there. They're going to give you an application to complete. Or you can give them a call and you can talk to someone on the phone and set up an appointment to get your application completed and do an intake. I do want to tell you this, is once you're done with your process, filling out all your paperwork, talking to someone at DSS, the Department of Social Services, it can take up to 45 days after you apply to find out if you get that Medicaid coverage. So here's where it's really important that you don't want to cancel that coverage if you had it from the ACA, Affordable Care Act. You want to make sure you keep that until you are sure that you have the Medicaid coverage. All right. So as we move on to the next screen, this is just another way to look at the 4 different ways that you can utilize to apply for Medicaid. ePass, that's the one that's online where you can fill it online. The paper application, where you're going to fill that out, pen and paper. You're either going to mail it in or you're going to take it into your DSS office. Or you can just actually go straight to your local Department of Social Services DSS office or give them a call. All right. So now what? Once you're approved, most people who get healthcare coverage through Medicaid are part of North Carolina Medicaid managed care. And what this means is that you choose the health plan that's best for you. And again, those are the 5 companies that I mentioned earlier. Those are the standard plans. WellCare, United Healthcare, Healthy Blue, Carolina Complete Health, and AmeriHealth Caritas. All of the health plans, they offer the same base services, full Medicaid coverage. But some have extra services. They call them value-added services. And each of the health plans has their own network of doctors and professionals. And that's where you're going to choose your primary care doctor from that network of doctors and professionals. So once you choose, once you choose that health plan and the primary care doctor, your family doctor, your clinic, or your healthcare provider, you're going to do all that when you apply. And when you receive your healthcare plan ID card in the mail, it's going to come from the health plan that you selected during the application process. If you didn't select one during your application process, one is going to be assigned to you. It will be you'll get that welcome packet from that health plan. If you're not pleased with that particular health plan, you have up to 90 days to pick a new one. And you're going to receive a packet from the North Carolina Medicaid enrollment broker that tells you how to change plans. So if you want to make that change, that's who's going to help you, the North Carolina Medicaid enrollment broker. So that ID card that you receive, it's going to have the name of your primary care doctor. If you did not choose one when you applied, one will be assigned to you. And again, this is the doctor that you go to for your annual physical exam to make sure that you're healthy and well. And you go to that same doctor if you're not feeling well, if you're sick, if you fall, you get hurt. You know, one of the big advantages of having a primary care doctor is it's that person that you can call when you're sick. So you've been to them for your annual exam. And then if you get sick, you give them a call. They're going to get you in to see you to get you the medical treatment that you need. Excuse me. If you want more information about this, there again is a link at the bottom of the screen, medicaid.ncdhhs.gov. It's a simple site to move around on, and it's going to give you some great information about health plans and providers, etc. So that's Medicaid expansion. Before I pass the baton to Rachel to talk about tailored care management, I want to share a little bit of information about another program called Healthy Opportunities Pilot. It should be on our next slide. And that is going to launch in 2024 in February 1. So this Healthy Opportunities Pilot, if you haven't, or if you're not familiar with it, it focuses on what is called social determinants of health. Now that's kind of a mouthful. So what are social determinants of health? So those are the things that all of us need to remain healthy. To have housing, to have food, a way to get places, transportation, and personal safety to make sure that you feel safe in your own environment. And so what this program does is provides resources in all of these 4 different areas. If you're concerned about housing, perhaps you're concerned you're going to lose housing, or maybe you don't have housing at all. If you have concerns about food or transportation or personal safety, this particular program is focused in those areas, and it works together with health service organizations across the state, such as food pantries or food banks or agencies that help with housing, transportation, those agencies that help with personal safety, domestic violence, that type of service organization. And it is for individuals who have Medicaid and are eligible for this particular program. Right now, when it launches on February 1, in our catchment area for partners, it's for Burke and Rutherford County. So as right now, it's a pilot. There is hope that it will open across the state. But at this time, that's where it will open, in Burke and Rutherford County, for us here at Partners. And there is a link at the bottom of the screen that I know for sure that Stacy dropped that link into the chat for you. So that's Healthy Opportunities. All right, so shared a lot of information with you. I'm going to share a little bit more with you before we go into our question and answer period. So right now, I am going to pass the baton over to Rachel Jerzak. Rachel is is part of partner staff here, and she is the director of our care management team for intellectual and developmental disabilities. So take it away, Rachel.
Thanks, Anne. I appreciate it. Hello, everyone. I'm Rachel Jerzak, the director of IDD Care Management here at Partners, and I'll talk a little bit about a couple of items near and dear. So the first one is tailored care management, and Partners, well, statewide, tailored care management started a year ago, December 1st, 2022. So we moved from care coordination or previous care management models to tailored care management. And sometimes not to be confused with the tailored plan, which Anne talked about a lot earlier, that is going live on or before July 21st, 2024. Tailored care management is a service that we provide that helps coordinate care for members. It focuses on the whole person, not just the supports and services in behavioral health or IDD or TBI that was previously focused on, but it does focus on the whole person, including physical health. We serve special populations such as Medicaid members who need enhanced behavioral health services. And those are the things like innovation services or residential services or outpatient therapy, those types of targeted behavioral health services. We serve the individuals with intellectual and developmental disabilities, IDD, TBI, which is traumatic brain injury, and innovations waiver enrollees, and the waitlist members. So people that are on the registry of unmet needs waiting for an innovation slot also receive care management, tailored care management. We also provide tailored care management, and it might be called a little bit different for those members that are non-Medicaid, but still are eligible for some behavioral health, developmental disabilities, and TBI services. And those individuals are usually the uninsured or underinsured members because they don't have Medicaid. Tailored care management offers members choice on how they receive their care management. They can receive care management from partners, or they can receive care management from an external agency that provides care management, tailored care management services, whether that's a CMA, which is a care management agency, or an AMH Plus, which is an advanced medical home. So there's three options of how to receive tailored care management. Members can opt out of tailored care management if they so choose, but when they opt out, they're also opting out from the benefits that come with the tailored care management model. Next slide, please. Partners does provide some short-term care coordination to those individuals that are uninsured or underinsured. And these individuals typically have high needs, whether that's behavioral health needs or service needs. But typically we go in and we are able to help navigate the system with the member, link them to the services that they are needing to keep them healthy and safe. And then we back out of that situation once they are linked to the services to help them. And that's usually a short term, whether 30, 60, or 90 days long. In order to connect to care management, there's really no wrong door, but we have some specific phone numbers listed here that'll be on your slides that you get. And the first place you can go is Partners Access Line, and we have our 1-888-235-4673 number. We also have the IDD care management lines as well as mental health, substance use disorder care management lines. We have separate ones for all of those. Next slide. So we're going to share a little bit about what can tailored care management do for you. And I believe we're going to pull up a different slide. And we borrowed this from, and it was approved to borrow from the ARC of North Carolina, and because it really does outline very well things that tailored care management can do for members. Care management is a choice. You have a care management team to help you plan medical care and coordinate supports and services in your life. Care management looks at the whole life with the goal to make sure everything is working together to benefit you the most. It could mean helping you find resources that are important to you, such as getting your medical care. We can help you find primary care physicians, help you find pharmacies, help you with medication management, getting the supplies that you need for your medical needs, and other supports to help improve your health. We can also assist you in finding resources for basic needs, a lot of similar to what Anne spoke about earlier, social determinants of health type needs, such as transportation, housing, food, other types of things that you might need that are not typically paid for through your Medicaid services. We can link you to housing supports, locate housing options and resources, help get you linked up with people in the community that know those systems best, link you to employment resources such as supported employment or the vocational rehab department of the community, provide education about your rights, self-determination, money management, literacy, getting resources in the community to help you obtain a high school diploma or GED, or even higher education, and helping with assistance or helping you find financial resources such as applications to Social Security Administration for the SSI and SSDI programs, assist you with Medicaid and Medicare, help you find ways to manage your income, link you to financial planning assistance, linking you to child care, school assistance, such as child care subsidies, locating after school care, having a place at the table to help along with the individual educational plans, the IEPs, or the 504 plans at your school. So this is a large list that has been added to care management since December of 2022. And compared to the previous care management model, where we focused mainly on your behavioral supports and service needs. So this is truly looking at the person in a whole person care type of view. Next slide. Okay, I'm going to switch gears a little bit. So now I'm going to concentrate solely on the innovations waiver. And as you all know, the innovations waiver implemented some COVID flexibilities back in March of 2020. And we are still under those COVID flexibilities that are called Appendix K flexibilities. So the waiver recognized the need to make some adjustments so that people's services could continue in light of the pandemic that started back in March of 2020. The original plan was that the Appendix K flexibilities through the innovations waiver would end 6 months after the federal public health emergency ended. And our federal public health emergency ended in May of 2023. So the Appendix K flexibilities were supposed to be ended in November of 2023. Our state had put into the Centers for Medicaid and Medicare a technical amendment, and the technical amendment was proposing to CMS, which is the Centers of Medicare and Medicaid, the addition of some of those Appendix K flexibilities to be permanently added to the North Carolina Innovations Waiver, because they didn't previously exist. And once the Appendix K flexibilities ended, so would all of those flexibilities. They would no longer continue. As is everything, since the pandemic, things change and certain needs and supports are needed in order to continue meeting the health and safety of our Innovations Waiver members. So they submitted that request. The Appendix K amendment, or the Innovations Technical Amendment, has currently been approved. There are specific flexibilities that will be added permanently to the North Carolina Innovations Waiver, and that technical amendment will begin March 1st of 2024. Until then, the current flexibilities will continue through February 29th, 2024, and then the technical amendment will be in place effective March 1st. A few of the items that have been added to the technical amendment, which will be effective March 1st, 2024, is they removed the requirement of members that have day support services to have to attend the day support facility one time per week. Previously, if you had day supports, you could receive your day support services in the community and you wouldn't have to go to the day supports facility except for one time per week. And now, effective March 1st, that requirement will no longer be part of the Innovations Waiver. Previously, prior to COVID, there was the capitation of Innovations annual service plans. A member could continue receiving innovation services if their needs could be met within the $135,000 annually to meet their service needs. Over the course of the pandemic, expenses have risen and service rates have risen, so the state of North Carolina identified that they needed to request that cap to be increased, and CMS approved to increase the annual waiver cap from $135,000 a year to $184,000 annually, and that will go in effect March 1st of 2024. Parents of minor children under the pandemic, under Appendix K flexibilities, were allowed to provide services to their minor children, which was never part of the North Carolina Innovations Waiver prior to COVID. This was done out of need due to the lack of direct service employees and staffing issues that arose from the pandemic. In an effort to correct some of those problems or alleviate some of those problems, the state of North Carolina asked that parents of minor children be able to continue to provide some of their supports if needed. And they will be able to do that if the minor child has extraordinary needs, and the parents will be able to provide community living and supports up to 40 hours per week for their minor child. Another addition to, and that will go into effect, March 1st of 2024. Another addition was prior to COVID, some adult members living in their own place, such as their own apartment or their own home without living with natural family, they were receiving a service called supported living. And one of the exclusions prior to COVID was that their families or relatives could not provide supported living services as a paid support. Through the pandemic and results of COVID flexibilities, the state of North Carolina asked CMS to allow relatives to provide supported living services to those adult members living in places of their own, and that was approved as well. Prior to COVID, relatives of adult members only were able to provide community living and supports up to 40 hours a week, and in certain circumstances, up to 56 hours a week. And with this new technical amendment, the state of North Carolina requested an increase of those hours. So it has been approved that relatives can provide community living and supports to adult beneficiaries or adult members up to 84 hours per week if deemed necessary. Next slide, please. The following Appendix Ks have been approved as permanent parts. And again, these are continued list of some of the things that were approved to be part of the permanent waiver. During COVID and prior to COVID, this was not available through the waiver. We did not have home delivered meals as a service in the North Carolina Innovations waiver. When the pandemic occurred and people needed access to meals due to shortages and inability to get out and get groceries or whatever the situation was happening at the time, Appendix K included that they could receive home delivered meals. So as part of the permanent request and approval, Innovations members that do not reside in residential living situations, such as residential supports with a group home or other AFL type placement, those members will be able to access up to 7 meals per week or 1 meal per day of home delivered meals. Another big change was the use of telehealth for some of the services. Pardon me. And community living and supports, day supports, supported employment, supported living, and community networking are services that the technical amendment were approved to be provided via telehealth, meaning two-way audio-visual telehealth, meaning that if the member is able to benefit from somebody interacting with them over a video type service and complete their goals, they could receive those through telehealth. And the amendment also included that services can be delivered in alternative locations, such as hotels, shelters, churches, or alternative facility-based settings when there is an issue related to COVID that prevents them to receive the services in the location in which it is supposed to be served. So that has been added as a permanent part of the innovations waiver as well. And all of the ones that I've mentioned to this point are effective March 1st, 2024. Next slide. All right, I'm going to hand it back over to Ann.
Hey, Terry, let's flip back to that question slide. There you go. Awesome. So Cindy is going to moderate questions. So we've shared just a ton of information with you. And so now's your chance. I know there's a couple questions in Q&A. So feel free to add more or raise your hand. So I'll let you take that, Cindy.
Good afternoon, everybody. I'm Cindy Trobaugh with Member Engagement, and I do want to encourage you to put your questions in the chat or in the Q&A. I apologize, in the Q&A feature. Go ahead and type those in there, or you can raise your hand and we'll take you off mute and you can ask your question live. One of the comments we received was that a couple of people were having trouble getting in to join the meeting today. Sorry that you all have maybe experienced some technical difficulties with that, but I do want to assure you that the slides will be sent out to those who registered, and those who registered that received the slides, feel free to share those with your contacts. We are also going to be posting the recording of today's Member Cafe on our partner's website. So it will be available in the future, in the very near future, for folks to access and watch it back. So please share that information with those who were not able to attend today, that they can get a copy of the slides and the flyer that we shared, and also watch the recording of today's event. And the next question is came up during when you were presenting on Medicaid expansion about income eligibility. And somebody was asking if the Department of Social Services takes into consideration household expenses, or if there's some deductions for bills for housing and other things. I do know that the application process takes into account household information, and they do look at assets. But this question is specific: do they take into consideration any household bills? So anybody on the panel who'd like to expand on the answer for that, if you know. And if not, we have shared with you ways of contacting your local Department of Social Services, all the different ways that when you do apply, and we've given you the link to the state Medicaid website. So if we don't have an answer for you today, we can help get that answer.
Yeah, Cindy, I can say that they should talk to somebody at their local county Department of Social Services, but typically it's based on income. So not on what you're paying out, but what comes into your household. Okay.
Thank you, Allison. All right, I want to encourage you to put any more questions, or we have a few more minutes. We've got time for a few more questions. Please raise your hand if you don't want to type it into the Q&A feature. I would be glad to take you off mute and let you ask your question. We've covered a lot of great information today. Do want to encourage you to share this information out with any of your contacts. You can refer them to us here on Member Engagement. We'll be glad to take questions. And I think there was a couple more. Is there some information that you'd like to give them on Member Engagement?
Yeah, we are kind of running close on time. So let's do this. Terry, if you can go down to, let's go down to slide 33, where it talks about member engagement. We'll go from there. All right, well, Terry's bringing up the slides. I'm just going to share a little bit of information with you about member engagement. So here in member engagement, what we do is we help families navigate, we educate and provide information like we're doing today. We also are out in the community. We go to resource fairs, different events in the community and share information. Member engagement also has a call line that we manage, and member engagement is where you can call in if you're not sure who to talk to. Member engagement is your place, so you can call 704-884-2729 for to talk with member engagement. There is one more question that came into the Q&A. It says, when are the innovations changes going to be into effect? So all the things you heard Rachel talk about, March 1st of 2024 is when all of those changes are going to be in effect, because the flexibilities that were not made permanent, that's what Rachel shared with you, the ones that are going to be made permanent, they're effective March 1, and anything else that was not made permanent, that was a flexibility, would have ended on February 29th. Did I get that right, Rachel?
Yes, that's correct. And you brought up a really good point that the ones I went over are the ones that were made that will be part of the permanent waiver after March 1st forward. There are many other flexibilities that were in practice and will be expiring and no longer available after February 29th, 2024, such as prior approval for additional units. Through COVID, you were able to receive some services without prior authorization. That will no longer be possible after February 29th. Employers of record that provide paid supports to their members under the self-direction model and innovations were able to provide some paid supports during COVID under the flexibilities. That is not part of the permanent waiver going forward. So that will end on February 29th of 2024. So it's really important not just to know the ones that were approved as part of the permanent waiver, but also recognize the ones that were not, and making pivots and adaptations to make sure that the member services can continue without those COVID-related flexibilities going forward.
All right. Thanks, Rachel, very much for clarifying that. So we are right up on 2 o'clock. I'm going to share one more little tidbit about Medicaid expansion that I did not add at the end. So for Medicaid expansion, I mentioned if you had insurance through healthcare.gov, the Affordable Care Act. So one of the things that the North Carolina is doing is sending out information, going to get letters. If you were covered by insurance through the Affordable Care Act, the letters are coming from Centers for Medicaid and Medicare, or from North Carolina DHHS. And those letters are going out December 13th, which is tomorrow. And then another one is going out in January. And that's just to let you know that you may be eligible for Medicaid and encourage you to apply for Medicaid with Medicaid expansion. I just wanted to let you know that there is a communication plan and information going out about that. So All right, last call for any questions you may have. We are right at 2 o'clock. Actually, I see 2:01. So I just want to say thank you for joining us for our member cafe. We want to encourage you to join us again in January. Our topic in January, we will have a subject matter expert here talking about seasonal affective disorder in January. So we encourage you to register for that and look for information on that. And we want to wish you just a joyful holiday season, and just hope that you experience joy and peace through your holidays with your families, with your friends, all of that. So again, thank you for joining us, and have a wonderful rest of your day. Thanks. Bye-bye.